Hello everyone, my name is Trang. I'm a rising junior majoring in biology at Gustavus. Welcome to my presentation about the cancer disparity in America, where I explore the factors that cause the disparities and how America is addressing this issue in terms of past research as well as future research. Before we get into the details, we must first define what disparity means. Health disparity occurs when quality of healthcare differs between individuals due to their income, race, ethnicity, gender, age, or where they live. And according to the Minority Health and Health Disparity Research Education Act of 2000, disparity in cancer refers to the overall rate of disease incidence, prevalence, morbidity, mortality, or survival rates. For cancer, disparity occurs during each step of cancer treatment, from prevention and screening to the quality of life after cancer treatment. Disparity occurs mostly to individuals from low socioeconomic standings, racial and ethnic minorities, and those living in geographically isolated areas. And for those that are not familiar with this issue might ask, why is this issue important? We've been investigating the reasons as to why cancer is more detrimental to certain minority groups and allow researchers to further investigate the underlying biology of cancer, which would help them formulate more effective approaches to cancer treatment. Another reason is that societal factors also play an important role in cancer treatment. Thus, by conducting studies on disparities, researchers could test out the effectiveness of different intervention strategies on populations with different needs and cultures. And so, what are the contributing factors? The main contributing factors stem to society because health is affected by where people live, work, and play, so we need to find the solutions for better health in those areas. Therefore, in order to solve the disparity, we must address the social determinants of health that are listed in the infographic, in particular, the lack of access to healthcare due to poor socioeconomic status. For example, minority groups are less likely to have recommended cancer screening tests because they don't have access to healthcare, and as a result, they might be diagnosed with later stage cancer that could have been prevented if discovered earlier. Another interesting factor that you might not think of is the cultural differences, such as mistrust in the healthcare system or misconstrued beliefs about cancer. If these factors listed on the infographic are addressed, then we can prevent larger percentage of potentially preventable cancer deaths that occur within these minority groups. Now that we have learned about the basics on cancer disparities, the next question that we must ask is, what are the impacts on our society? And according to the statistics from National Cancer Institute, disparities in cancer significantly impact African American communities. And as you can see from the two graphs, Black men have the highest cancer incidence and highest death rate for all cancer sites combined. For example, Black men have considerably higher death rate for prostate and lung cancer compared to other groups from 2008 and 2017. Similarly, Black women also have the highest death rate for all cancer sites combined, as you can see from the two graphs that show that Black women also have considerably higher death rate for breast and colorectal cancer from 2008 to 2017. Under the major impact is that minority communities such as African American, American Indian, Alaska Native, Asian and Pacific Island, and Hispanic are also significantly underrepresented in clinical trials, which is especially troubling because treatments created from these trials might not be applicable to them. Seeing how big the issue is, these are some examples of research that have been done to address the health disparity. The first example is a program that encompasses 3 projects developed by the University of Alabama at Birmingham: the DSN, REACH 2010, and CHAP. These 3 programs were carried out in the Black Belt of Alabama, where a large population of African Americans live in extreme poverty. And they aim to reduce disparity for medically underserved population by increasing awareness about the progress of cancer treatments, such as participation in clinical trials and improving quality of healthcare. One interesting strategy discovered from this study is that inclusion of community volunteers was very effective in increasing awareness and participation in the treatment process. Another example is the NCCP program, developed by the National Cancer Institute. It was a 3-year project that aimed to enhance access to care, reduce health disparity, improve quality of care, and expand research within the community setting. In this study, the NCI formed a public-private partnership with 16 community hospitals and oversaw more than 27,000 cancer cases per year. The program was very successful because it understands that the factors causing the disparity are specific to each site and that efforts to reduce disparity must be tailored to satisfy the unique needs of the disparate population. And thus it was able to determine effective methods to prevent disparity and propose solutions to the challenges identified during the program. And so if you're interested in reading these two studies in more detail, you can find them in the works cited itself. In conclusion, the fight against cancer should not solely revolve around the biological aspect, but we must also look at the social aspects of cancer. The good news is that the issues of disparity in cancer healthcare is gaining more recognitions as more research is being done. There is recent evidence that indicates progress in addressing the disparities, such as reduction in lung and prostate cancer deaths among African American men. Moreover, there are organizations that are distributing some of their resources into this topic. For example, the American Cancer Society has given 59 grants that amount to a total of $50 million as of March 2020. The National Health Institute also have various departments that are dedicated towards researching cancer health disparity and implementing strategies to reduce it. Despite the positive outcome, health officials and researchers agree that there is still a lot of more work needs to be done to reduce health disparity. And so, if you're interested in this topic, you can read more about it by using the link I provided here in this slide. And thank you for tuning into my presentation.